This training will be recorded, so feel free to do whatever you need to do for yourself. If you would not like to have your face or name omitted in the recording, please do so. Everyone's still kind of coming in. I'm gonna give it one more minute. I have a couple more people coming in. All right, welcome everyone. My name is Angela Fields and I'm a community health worker and I'm with the Minnesota CHW Alliance. And welcome to the December 1st CHW Learning Circle meeting. I'm glad to have each and every one of you here. Wow, it has definitely been a year. And as we approach our last CHW Learning Circle meeting for the end of 2021, I cannot believe how quickly and slowly as all at the same time this year has transpired. I would like to start off to let everyone know that is just joining the meeting today that this training will be recorded. So do whatever you need to do for yourself. If you would not like to have your name or face included in the recording, please do what you need to do to take care of yourself. As I stated, today is the December 1st Learning Circle meeting, and I will be your host and facilitator for this meeting today. We will start out with the mission and the vision of the CHW Learning Circle meeting. The CHW Learning Circle is a monthly meeting that allows CHWs to connect, learn, and tap into one another's knowledge through discussion. The Minnesota CHW Learning Circle is brought to you by the Minnesota CHW Alliance, which lays out a platform designed of clear organizational goals and objectives for the advancement of all those in the CHW profession. The vision of the CHW Learning Circle is to create a CHW workforce that encompasses the voice of those in the profession and solidifies our motto of nothing about us without us. Today, our topic and our guest presenters will be from Trellis. Trellis, formerly known as Metropolitan Area of Aging, we have a program within our network called Juniper. Juniper is a network of organizations, community-based organizations, and health systems that makes evidence-based health promotion programs available to people throughout Minnesota. Together, we are helping people live healthier, stronger, and more independent lives. We're going to start off today with introductions and roll call. I would really love to know who is on the call with us today. So if I can ask each one of you, if you're not speaking, could you mute your microphone so we don't have much feedback? Because it seems like there's quite a bit of us on this Zoom call today. And so I would like for you to introduce yourself, your name, your title, and the company or organization that you work with. So the first person that's on my screen that I see is Hannah. So we'll start out with Hannah, and then we will just popcorn effect on through until we've covered everyone. So I'll give it to you, Hannah.
Great, thank you, Angela. Hi, everyone. My name is Hannah Cass-Eaton. I'm a program manager at WellShare International, and I manage our family home visiting program there, where we have community health workers running our program, and my program, as well as many other programs at WellShare. So I recently started in my role and have been connected with Angela to assist with some of these learning circles. And I'm really excited for our topic today. So thank you, everyone.
Thank you, Hannah. And the next person will be.
And I'll just pick someone. That work?
Yes.
Okay. How about I see Shelley Clausen.
Hi, my name is Shelley Clausen, and I work at Sanford Health in the community education. So work with the programs that you're talking about today. And I work with the CHWs across the Sanford footprint. So glad to be here. And I'm going to choose one of our new CHWs, Juan.
Hello everyone, my name is Juan Torres and I'm the first community health worker at the Sanford Clinic. And I'm into Juniper 2 at the fall prevention to enroll patients. And I would choose Sue next.
Thank you, Juan. Well, hello, everyone. My name is Sue Yang. I am a community health worker, and I am with Juniper. I'm going to be one of the presenters today, too. And my primary role is to educate and assist participants in registering for the evidence-based health promotion class we'll be talking about in a bit, all throughout Minnesota. I am going to popcorn Andrea Lewis.
Hi there, I'm Andrea Lewis. I'm an RN clinical educator in Bemidji, Minnesota. I work for Sanford Health and I teach the living well with chronic disease and chronic pain classes here in the Bemidji region. Sorry, I suppose I should choose somebody else. I will choose Adri Lobitz.
Hi, thanks, Andrea. My name is Adri Lobitz, and I am the Executive Director for the Minnesota Community Health Workers Alliance. Thank you all for being here today and excited for Juniper's presentation. Oh, and I will choose, let's go to Barb.
My name is Barb Nordquist, and I'm from Sanford in Sioux Falls, South Dakota, and I work for Better Choices, Better Health, teaching the evidence-based programs.
Next.
Oh, and I will choose Vani.
Hi, my name is Von Yee. That's okay. If people get it wrong all the time.
I thought, after I looked at it again, I thought, no, I bet you that is Von Yee or something like that. Thank you for correcting me.
No worries. I'm Von Yee. I'm a community health worker, and my role is state delegated public guardian with Hennepin County, where I support elder adults with developmental disabilities. And my role is to just kind of provide advocacy and support for those people. And it ranges anywhere from, doing team meetings regarding their residential or their employment ability programs. But it also spans across to preparing DNI letters, as well as communicating with the rest of that person's team. So.
I'm going to jump in really quick. Sorry, Vani. I'm going to jump in quick and do Jihan's introduction. So Jihan Rashid is from Pillsbury United Communities in the Twin Cities CHW Hub. She's the director there. And we want to thank her for being here. Sorry, Vani. Just want to make sure Jihan gets her moment in the sun. You can go ahead and pick somebody now.
All righty. Let's choose Amanda.
Hi, thanks, Bunny. I'm Amanda. I'm in Fargo, North Dakota, and work with the evidence-based programming and the leaders of the Better Choices, Better Health workshops. And I'm also a leader myself. So we have a couple of members of our team on this call. So I will pick one that has it called Danae.
My name's Danae Cope. I work with all the Sanford ladies on the call as a learning and development specialist. So I support our evidence-based programs as well in the Fargo region. And then I also support some of our community health workers. I will pick Libby.
Hi, Libby Kylo. I am a community health worker for Sanford Health as well. And the rest of our team, I am located in Mayville, North Dakota. And I will choose Jordan.
Hi, I'm Jordan. I'm a community health worker with Sanford in the Bismarck area, and I also teach Better Choices, Better Health. I'll choose Faith. I don't know if she's gone yet.
Hi, I'm Faith. I work with Mayo in the Southwest Minnesota region. I am the registered nurse that works with our 3 community health workers. I'm kind of their clinical support person, do a lot of care coordination for them, and address like the medical chronic conditions and quality pieces. So preventative care stuff for them, as well as doing lots of education for them about chronic conditions and things like that. And I will choose Angie.
Hello, my name is Angelica, or they call me Angie. I am a community health worker at the Mayo Clinic in St. James as well. We work our community health workers are all Southwest region, and I work with the Latino population and anyone who has any kind of health disparities. I will choose, has Lula gone?
Hi, thank you, Angie. Hi, my name is Lula. I'm with Nicollet County here in St. Peter. And then my role is working in a public health with COVID response and then supporting public health nurses with home visits and supporting other county staff as well. I would choose Jen.
Hello, my name is Jen Emerson. This is my first Alliance meeting. I'm sort of new to the CHW world. I am going to be working with Lutheran Social Services with their Community Companions program, and I start on Monday. Let's see. How about Angelica?
I think Angelica went already.
Is she? Oh, okay. How about Lauren?
Hi, I'm Lauren Peterson. I work with Juniper as well. It's my 3rd day, so I am getting up to speed. I'm a provider relationship and experience manager here. So I'll pass it over to Rachel.
Thank you, Lauren. I'm Rachel Von Ruden. I'm a provider relationship manager at Juniper, located in the Twin Cities. And I will pass it on to, how about Carly?
Hi, I'm Carly Swanson. I also work for Sanford Health and work with our Good Samaritan Society facilities across Minnesota, getting them connected with evidence-based programs as well. And I will pick Jen.
I think Jen went already.
Oh.
We have Carrie and her lovely companion.
Hi there. My name is Carrie Harris. I got my pup on my lap here. I work for Volunteers America. I'm a community health worker, and I also manage a small community health worker program. We work in the low-income public housing high rises in Minneapolis. And who is left? Is it Keisha or Keisha? Is she gone? Who is left?
Yes. Hello, ladies.
There we are.
My name is Keisha. I'm a nurse here in Minneapolis and a community health worker. And I do continuing education and education and education. That's what I do. Glad to be here.
And welcome, everyone. Thank you for sharing who you are and what you do. Really appreciate you being here in support of the Alliance as well as the Juniper and your organizations. As we move along with the meeting, I will start introducing our guest presenters, which are, I also have the pleasure to introduce my colleagues and my teammates. I will go into give you a little snippet of who they are and their roles within the organization. So I'll start out with myself, since I'm already talking. And as you know, I'm Angela Fields. I'm a community health worker through Chalice, and the program that I work within the organization is Juniper. And I gave a small overview of Juniper in the introduction for our topic, and as the presentation roll out, you'll learn more about Juniper. Next, I have Sarah Von Ruten. She's a program relationship manager with Juniper. I have Sue Yang. He's a wellness engagement specialist and also a community health worker. And he is cited at the Health Partners Neuroscience Center, the Pain Clinic. Then I have Juan Perez, which was he was an interpreter, then went on to in the pursuit of his CHW certification, and he's at Sanford Health. And I thought I saw her pop in, but I'm not sure. My immediate supervisor, Sarah Blonigan, she's the Juniper Network Director. All of this information from this meeting is being recorded, and I will send out meeting minutes of all those that I have access to their emails. It will enlist the overview of Juniper, the program, and the program descriptions. Now I'm going to turn our presentation over to Rachel Von Ruten to start us out. Please, all of those that are on unmuted mics, please mute your mics, so therefore we won't experience any feedback or as minimal feedback as possible. I'll let you have it, Sarah. I'm sorry, Rachel.
That's okay. They called me Erica at my graduation, so if you call me Sarah in this meeting, I can take it. It's all good. All right, so let me just make sure I'm sharing my PowerPoint. Can I see a thumbs up if you can see the PowerPoint slides? Fabulous, thank you so much. So we are very excited to be with you today sharing Juniper. I'm going to do my best to manage the chat as I'm talking, so please feel welcome to use the chat if you have any questions about anything that I mention as we go through the presentation. So we're here today to share with you what Juniper is, and it's an opportunity to use evidence-based health promotion programs to drive better health outcomes for Minnesotans. And before we talk more about Juniper, I want to set the stage a little bit more with some facts and figures. So we know that as our older adult population increases, we also have more and more people living with chronic conditions. At least 80% of people over the age of 65 are currently living with a chronic condition. And many of these are created by modifiable risk behaviors such as lack of exercise, poor nutrition, tobacco and alcohol use. And there are things that we can do to prevent or reduce the severity of these chronic conditions. We also know that 1 in 4 older adults are living with diabetes, diagnosed or undiagnosed. And a national study recently found that 53% of older adults reported feeling some type of bothersome pain in the preceding months. And we know with the opioid epidemic as well that chronic pain is a very serious issue. Finally, we know that about 1 in 3 adults over the age of 65 fall each year. Falls are the leading cause of fatal injury among older adults, and half of non-injured fallers cannot get up without assistance. And the fear of falling is a recognized syndrome and leading risk factor for falls, as it often causes older adults to exhibit behaviors such as limiting their activities, which can lead to further physical decline, as well as depression and isolation. So I have a question for you, so please use the chat to respond. Of the 50 states, with 1 being the worst and 50 being the best, where do you think Minnesota ranks in fall-related deaths for older adults? 1 being the worst and 50 being the best, where do we rank in fall-related death rates? 5, 40, 35, 5, 10, 36, 5, 15, 30. Thank you so much. Those are good guesses. In Minnesota, we like to think that we're #1 in a lot of things, but we are not very good when it comes to fall-related death rates for older adults. We actually rank 3rd in the nation, behind Wisconsin and Vermont. So we rank really high. Now, again, use the chat, and why do you think that is? Why do we rank so high in fall-related death rates in Minnesota? weather, snow, weather, ice, ice, weather, ice. Good guesses. That's really common. That's what people think. But if that were the case, we would probably see a peak of falls in the winter months and a decline over the summer and spring, the warmer months, right? And in fact, what we see is people tend to, the falls rates tend to stay pretty steady throughout the year. We'll also have some people sharing elders or isolated, people living at home alone, poor programming, support, and education, right? So people don't have the opportunity to maybe be out and exercising, or they don't have the support to do things that they want to do that would keep them active. And that's actually what they think leads to the high fall-related death rate. It's not directly the ice, it's what we do in the winter when it's cold outside. I know for myself, I tend to stay home. I probably find more excuses to not go to the gym, to not go for a walk because it's dark outside, it's icy. And because of that, over the winter months, we lose physical conditioning, balance, and flexibility, which puts us at a greater risk for a fall. All right, and when we look at the social determinants of health pie chart and what drives health, and there's lots of different versions of this. This is one that we choose to use for our presentation. We know that only about 10% of what drives health is clinical care. And clinical care, our hospitals and our clinics are such an important part of what keeps us healthy. But there's a much larger piece of that pie, which is health behaviors that we can use to help improve the health outcomes of individuals. And it can be an extension of what people learn in the clinic setting. And that's really what evidence-based health promotion programs are all about. These classes are rigorously researched and demonstrate reliable and consistently positive changes in important health-related measures, including improved quality of life, increased self-efficacy in managing one's health, increased or maintained independence and positive health behaviors, fewer falls, reduced pains, and positive effects on depressive symptoms. The health promotion classes are not a replacement from clinical care, goodness me. They're a complementary enhancement. So they're an opportunity for patients or community members to take what they're learning with their healthcare providers and have an opportunity to practice changes or implement changes in their daily life, in their community, with the support of a peer group. Juniper offers 13 different evidence-based health promotion classes. All of the classes are available in person or online, and some are also available by phone. We have classes available in a variety of languages as well. We tend to bucket our classes into 3 categories. We have Live Well, Get Fit, and Prevent Falls. The Get Fit classes are all exercise or movement classes where the participants are active throughout the entire class, doing either a walking program or more of a typical exercise aerobic program. The Get Fit classes can be adapted to all ability levels. Live Well classes are highly participatory classes with a mixture of lecture, activities, and discussion. Some of the classes even include exercises. And our fall prevention classes, 2 of them, Matter of Balance and Stepping On, are more of a classroom style, highly participatory with a mixture of activities, lecture, and discussion. And the Tai Chi Chuan Moving for Better Balance program is a balance training program that uses Tai Chi forms and is completely movement focused. And we're going to take some time to highlight a few of those classes later on and also show you where you can learn more about our classes. But a bit more about the Juniper network itself. We are a network. We're a network of about 80 community-based organizations. Each of the organizations that are part of the Juniper network manage their own class leaders and offer a variety of Juniper classes in person and or online. By operating as a network, we're able to come together and earn grants and awards, grant awards, and have partnerships and health plan contracts so that we can continue to improve the lives of Minnesotans. And a great example of that is our current partnerships with Sanford Health, with Juan, and with Pres Homes, with Angela, and with Sue at Health Partners. And we'll share more about that later as well. Since 2018, Juniper has served over 13,000 participants in over 1,400 classes. And we do collect pre and post surveys from all of the participants in all of our classes, which allows us to measure the outcomes of the classes, which is information that we can share back with referrers, people who refer patients or community members to classes, and to funders to demonstrate the positive impact that these classes have on the lives of Minnesotans. So, and I included a snapshot of our data for you today. So as examples, participants in our Living Well classes or Live Well classes, 95% say the class helped them to eat healthier, 93% say the class helped them to increase their physical activity, 91% say that the class helped them work with their healthcare professional, which is so important. 97% say that the class helped them feel better or much better about their health in general. And for our fall prevention classes, 94% say that the class helped them prevent a fall, 88% say that the class helped them manage stress and fatigue, 85% say the class helped them socialize more with others, and 96% felt more satisfied with life. All right, any questions about Juniper before we move on to our programs? Fabulous. If you have any questions, feel welcome to just pop them in the chat. So the first class that we wanted to highlight is our class, A Matter of Balance. This is one of our fall prevention classes that is a mixture of lecture activities and discussion. What I like about all of our more classroom style classes is that they aren't sit and listen classes, they are highly participatory. I have a friend who runs a radio program for seniors in the Twin Cities, and he has this saying that I love. It goes something like, if you tell me, I'll forget. If you show me, I might remember. If you involve me, I will understand. And that's what these classes do. They help involve people in taking charge of their own health and making changes that the person wants to make with the support of a group so that they can move forward on their health journey. So the Matter of Balance class is 8 weeks. There are 2 trained facilitators for this class. There are exercises that are done for balance in sessions 3 through 5 of the class. And in session 7, a guest speaker is brought in to talk to the group about how to get up from a fall. And in the class, participants learn to see falls as something that they can control or something they can take action to prevent. They learn to set realistic goals for increasing activity, and they learn to change their environment to reduce their risk factors of falling. One of the main focuses of the Matter of Balance class is changing how people think about falls and their risk of falling from something that is inevitable to something that they can take action to prevent. So there is a lot of reconstructing of thoughts that happens in the class. So instead of someone thinking, well, I would love to go to the Twins game, but I'm nervous about navigating the stadium steps. I'm not steady on my feet and I don't want to fall, so I won't go to the Twins game. Changing that to, I want to go to the Twins game. I'm nervous about the steps. What can I do to make myself more comfortable? Well, maybe I could call my friend and ask them to come with me. Maybe I could call the stadium and see if I can arrive early and have help from one of their staff members to find my seat. So more solution focused. And one of my favorite activities in the Matter of Balance class is the assertiveness activity. And for the sake of time, I'll just kind of talk through this. But one of the first questions we ask the group is, well, what does it mean to be assertive? Well, an assertive person doesn't insist on having things their own way, but they also don't negate their own rights by always going along with others. What does being assertive have to do with fall prevention? Well, often to implement solutions or to create an alternative to a risk-taking behavior, we have to ask for help. However, many of us have a difficult time asking for help or saying no when necessary. And what are reasons why we fail to express our feelings or needs? Oftentimes here participants will say things like they're worried about loved ones thinking that they can't take care of themselves or that they can't be independent and having some of their independence taken away. Or concerns about being a burden. That's one that I have heard a lot with classes that I have led. But what difference does it make if we are assertive or not? If we are assertive, we get to continue doing the things that we love to do because we have the help to do them. And there are ways that we can ask people for that help. Maybe not ask everyone, but ask the people that we trust and we know have our best interests at heart. All right, so with that, I'm going to pass it over to Sue to talk a bit about Tai Chi.
All right, well, thank you so much, Rachel. So I'm going to be talking about the Tai Chi Chuan Moving for Better Balance program. I myself am one of the leaders. And just out of curiosity, who here has ever heard of Tai Chi Chuan before? Great, so it looks like a few people here have heard Tai Chi Chuan. Well, that was just a curiosity question, and regardless if you have any experience or if this is the first time you learn about Tai Chi Chuan, the really unique thing about what, and Rachel highlighted earlier, is that Tai Chi Chuan is a movement-based exercise program that's adapted to prevent falls. So everyone's welcome, and it's very accessible for any fitness levels as well. So whether you're doing these exercises standing up, sitting down in a chair, or using that chair as a support, really the class is intended to be able to demonstrate different variations, whether you have more mobility than some others, and everyone really does come in different forms. And so this program, as I mentioned here, is a program that's designed to help older adults improve balance, build strength, and also reduce the likelihood of falling. And some of the things that participants are able to take away from this program is learning balance skills, good body alignment, and also Tai Chi Chuan coordinated movements. And throughout this, the 24 sessions that for the Tai Chi program, participants will be able to learn 8 different forms of Tai Chi, and also various exercise movements to really help build that strength and work on that balance. And the reason why it's 24 sessions, that might be kind of a lot on paper, but it's really what I tell participants: practice, practice, practice. Being able to practice these moves over the progression of time for the program. And as participants progress over closer to that last 24 sessions, it goes from easy to difficult progression. So the first session is going to be more of introduction, learning some of the simple movements. And then once you learn that, you'll build on the first form, second form, and other movements to really help prepare people to be able to demonstrate these forms here. And so it's a total of 24 sessions. It's usually about 2 to 3 times per week, kind of depending on the leader and their schedule. And it's 1 hour each session. And if it's 2 times per week, it's about 12 weeks. And if it's 3 times per week, it's about 8 weeks. This program is really for anyone who wants to build strength, work on balance, or just want to have fun or try something new, because it's really, again, it's available and accessible to everyone who wants to join. And people who've taken the program has had a 55% in falls reduction rate. And then I know that describing that could be kind of hard to explain. So what we'll be doing next is going to be a 10 to 15 minute demonstration of some of the forms. So we're going to be going through some warm-ups, and then we'll be also doing a form 1, which is move a ball. That will help us kind of learn a little bit more about what Tai Chi is and the types of movements that's involved. So I'm gonna change my camera here very quick. And before we start, and I'm still here, but I'm changing my camera view here. Rachel, if you can change the view to focus on me. And ideally for this program, we would like everyone to, I know that with where we work, we're probably using computer chairs, but ideally if you have a chair that has no wheels, that would be wonderful. If not, we'll be able to kind of go with it. Sorry, 1 second here. So if you could grab a chair that has no wheels, that's awesome. But if not, don't worry about it. So I have a chair with no wheels here. And if you don't have a chair with no wheels, we want everyone to try your best. And the most important thing is to be safe and also have fun. And the first thing what we're going to do here, so when we sit down here, I have a chair here. Both feet are flat on the ground. Let's straighten our back here. So straighten our back. Relax these shoulders. I know sometimes I have a hard time relaxing these shoulders. Let's have our arms come to our side here. Both feet are at least hip distance apart. And the first thing we're going to do is just take 3 simple breaths. And what I teach everyone is that when we do any kind of movements, we like to synchronize our breath with these movements just to help us recenter ourselves. So our arms are on our side. Let's take a deep breath in. As we take a deep breath in, we're going to inhale through our nose, exhale through our mouths. So let's take a deep breath in, arms forward. Exhale. The second one. One last time here. Good job here. So we're going to scooch up here so that our back isn't laying on the back of the support here. So what we're going to do next is we're going to do an exercise, another breathing exercise. So let's start off by having, again, back straight, relax your shoulders. Let's take a deep breath in, arms forward. And what we're going to do next, my right arm, I'm going to start on my right. I'm going to form a ball. My left arm is going to be come on the bottom. So we're forming a ball. Ideally, I'm using the top. So top is going to be around chest height. And then our left arm is going to be slightly above the belly button. So this is a good size ball that we want to form. And we're going to do some breathing exercises here. So let's take a deep breath in. As we take a deep breath in, let's expand the ball. Exhale gently, squeeze the ball. Take another deep breath in. Exhale, squeeze the ball. Let's do this one more time. Exhale, squeeze the ball. This time, let's have the ball come to our side. So same concept here. As we inhale, we're going to expand the ball. Exhale, squeeze the ball gently. One more. And let's do one more for good measure here. Let's have our arms come to our side. Good job there. All right, so we did those breathing exercises here. And again, throughout these movements, we're going to continue to synchronize our breath with each movement. And we're going to be doing some simple seated weight shifting exercises next. So let's recenter ourselves, back straight, relax these shoulders again. Both feet are flat, firm on the ground. All right, so what we're going to do next is the weight shifting forward and backwards. And when we shift our weight forward, we're going to be engaging the trunk area and the hips area. So just gently shifting our weight. So imagine if somebody's pulling on your nose, right? Put your nose on top. So let's inhale, chest up. Exhale, coming back to center. This time, let's shift our way back. And we're not going to go all the way back until our back is touching this support here, but just slightly noticing that weight shift here. So let's inhale. Exhale, coming back to center. Let's go forward one more time. Exhale, coming back to center. One last time, going back. Exhale, coming back to center. Good job. This time, we're going to shift our weight, focusing on shifting our right and left. So arms to the side here. So we're recentering ourselves here. And when we shift our weight, our chest is going to still be forward, chest up. We're just going to slightly shift our weight to the right. Take a deep breath in, exhale. Let's go to the left side this time. And you're going to notice that weight shift. It's going to be on the left side here and around your buttocks here. That's when you know that you're shifting your weight. One last time to the right. Exhale. And one last time on the left. So we're going to put those two together, form a ball, and the weight shifting here. So we're going to recenter ourselves here. Let's take a deep breath in. Arms forward. Let's form a ball here. All right, so we're forming a ball. I'm starting with my right, and we're just going to shift our weight forward and backwards again. Let's go back this time. One last time forward. And one last time back. As now, this time we're going to shift our weight to right and left. And every time we switch, we're going to alternate our arms. So I'm going to start with my right. You start whichever side is comfortable with you. I'm going to alternate this time. One last time on the right. And one last time on the left. Arms to our side. Let's exhale. Arms to our side here. Good job. I'm going to do 2 more exercises here. And I'm going to change my view here. So you guys stay where you guys are at. I'm going to change this side here so that you guys can see. And we like to call these the momentum-based push-off here. And they're also known as the 3-ups. So as you can see, my back is straight. Relax the shoulders. Both feet are flat on the ground. And this exercise is meant to help us push off from our chair using our momentum in a safe way. So there's 3 parts here. I'll demonstrate here first, and then we can go through each part here. So again, I'm going to demonstrate here first. And if you don't have a chair that doesn't have wheels, try your best. The most important thing is to stay safe, okay? So I'll demonstrate this first. All right, is everyone still with me? All right, let's practice this, and then that will help us push off from our chair, transition into our first form. And we'll finish off with that first form here. So again, the first part here, there's 3 parts again. First part, what we kind of learned earlier is that shifting weight forward. Instead of just shifting weight forward, we're going to add these percussive arm swings to help us build that momentum. So let's try the first form out. Let's try that one more time here. Good job. And the second part is we're going to use the percussive arm swing to push us off slightly from our chair, not too much, but the most important thing is that we're going to slowly control as we come back down. So let's practice the second part here. Control. as we sit down. Good job. And then this last part here is going to be the one where we come all the way up. So let's just practice this. And if you have a hard time pushing off, you can use your momentum from your legs, or you can hold on to the bottom of the chair here. But be safe if you're going to do that. Use it, do what you can, basically. We're going to do the last form here. We're going to come closer to our chair here, making sure that our calves are touching the end of this chair. Make sure that we're safe. We're going to take a deep breath in. Exhale, slowly controlling ourselves as we sit down gently here. And we're going to just do this one last time here, and then we'll move on to the last form. Everyone still good? All right. All right, 3 parts here. All the way up. Exhale as we come back. So we're all should be standing now. And the last thing I will be doing here is form 1, move a ball. So I know you guys might not be able to see my face completely, but if you can see my feet, that's perfect. So this next form is form 1, move a ball. As I described earlier, it's the one out of the 8 forms that we'll be learning throughout the program here. So let's get in position here so our back is straight. Let's relax these shoulders, and let's relax these legs. Sometimes I don't want everyone to lock their knees. Relax these knees here. So back straight, relax these knees, hip distance apart. I'm gonna start on my right. You start whichever side makes you comfortable. So since I'm starting on my right, I'm gonna inhale, arms forward. We're gonna form a ball. And then my right leg is gonna be holding 80% of my weight. Left leg is gonna hold 20%. So on the side, the left leg is gonna hold up 20%. Right leg is gonna hold up 80%. And then I'll demonstrate here first, and then we can go through it one last time here. All right, let's do this one round, and then we'll finish off here. All right, so the first thing what we're gonna do, we're in position here. We're gonna inhale and slightly wind up. So we're gonna slightly rotate our trunk area and our hips. We're gonna exhale. As we exhale, this leg here, this left leg, is gonna be a quick step to the left. And then when we do a quick step, always heels down first, toes after. We're gonna drop the ball at the same time. We're gonna shift our weight, creating that instability. Back to stability. We're gonna push off. Feet together, forming a ball on the other side. We're gonna do one more time here from left to right. Let's inhale, wind up, slightly rotate our trunk. Exhale, quick step to the side. Let's drop the ball. We're shifting our weight to the other side now. We're gonna push off with this leg. Let's put our feet together, forming a ball on the other side. Let's take a deep breath in. Have our arms come to our side. Exhale out. And that's the end of the demonstration here. Thank you all so much for participating. All right, so the last thing I want to end off here, talking about the Tai Chi Chuan program, is an impact story. of one of the participants, two of the participants that took our program here. So this story is about Mary and Joyce. In May of 2020, Joyce left the isolation of her assisted living home and moved into her daughter's home to help prevent COVID-19. The daily love and care from her family is good, but at age 100, with limited mobility and separation for friends and activities felt isolating and caused depression for Joyce. Joyce's daughter, Mary, signed them up for an online Tai Chi Chuan Moving for Better Balance class. The twice a week classes help ease Joyce's loneliness and also provided an opportunity for mother and daughter to build strength and balance. From the class, they both learned to be more mindful and deliberate in their movements, slow down, and not move so quickly, understand the impact of shifting weight and its impact on balance. And now that concludes our program for the Tai Chi Chuan Moving for Better Balance. And is everyone still with us? All right. Now we're going to be talking about the Living Well. Our next program we're going to highlight is the Living Well with Chronic Conditions class. Now this class is a self-management program that's designed to help people with living with chronic conditions be able to manage, build confidence in managing their chronic conditions, at the same time living healthier. And this program was actually developed by the Stanford University as a collaborative research between Stanford University and also Northern California Kaiser Permanente Medical Program. And this is currently being managed by the Self-Management Resource Center. And as you can see, this is a 6-week program. And earlier, Rachel said that these classes can be offered online, in person, and some through telephone. And there's usually about 2 leaders per class. You meet about 2.5 hours each week. For telephone, it's going to be 1 hour each week, and there's only 1 facilitator. But some of the topics that participants are able to go through this class involves including fatigue, managing sleep, using your mind to manage symptoms, problem solving, dealing with difficult emotions and physical activity and exercise, preventing falls, making treatment decisions, communicating with family, friends, and health professionals, and dealing with depression and managing medications. And the target audience for this class is any adults that have 1 or more physical or mental health conditions, and especially valuable for older adults and patients with multiple chronic conditions, people with rising health risk, and those that are lonely or fearful. And again, it's going to be available in person, online, or over the phone. And just something here is that the original research that found that participants who took the Living Well with chronic conditions, when compared to those that were not, demonstrated significant improvements in exercise, cognitive management, communication with physicians, family, and friends, health distress, fatigue, disability, and social activity limitations. And people also spend fewer days in the hospital and also a lower trend of outpatient visits and hospitalizations. Next slide, please. So we are going to be doing an activity that's part of the Living Well with chronic conditions. Not just living well with chronic conditions, but living well with diabetes and living well with chronic pain. They have an element of, consists of brainstorming and action planning, but we'll be doing an activity for action planning in a bit here too. So as Rachel highlighted earlier, these classes aren't just a sit and listen lecture class, but it's more of a lecture, brainstorming, and a part of discussion. And discussion is actually a really big part of the class that really engages participants in a group discussion, group discussion and problem solving. And any of the problems that do express in the group do come from the group. And by being able to share ideas and solutions through brainstorming, and discussions, participants are able to really share and learn from each other and build a community of within the class. So we are going to be doing some brainstorming here. I do have 2 questions here, but I'll give everyone a few minutes here. And then when we do share, if you can all copy that into the chat box, and if Rachel or Angela can kind of monitor some of those. And I'll give everyone a few minutes here. And some of the guidelines before we start the brainstorm is that anyone can share. So we're not going to pick on one person to share, but anyone can share. There's no commenting during the brainstorm, no questions until after, and clarifications wait until after everyone has the chance to share. And I'll give everyone a few minutes here. All right. So the first question for our brainstorm activity is, what things can cause fatigue? And again, feel free to copy that into the chat box here. Fatigue, dehydration, chronic pain, stress, lack of sleep, illness, stress, medications. So strenuous physical activity, medication, okay. Depression, poor diet, anything else? Technology, mental illness, up to the BR frequently, bathroom, alcohol, all right, I think that's a really good list. And being sedentary, okay. Great. At anxiety, and I think that's a really good list that we have for this brainstorming activity. Now we can move on to the next activity. The next question here is, what are some ways to get a good night's sleep? And I'll give everyone a few minutes, but if you want to kind of similar to what we just did, just enter that into the chat box here. Good hygiene, meditate before bed, melatonin pills and magnesium spray, relax before bed, bedtime routine, essential oils, turn off the phone, comfortable bedding, exercising during the day, don't watch TV, use technology directly before bed. Anything else? Eat healthy, okay. Decaf afternoon. Reading. All right, well, I think that's a really good list. Thank you all for taking part in this activity for the brainstorm. And the purpose here is to allow us to share as many ideas about a topic as much as possible in the quickest way possible. And why is this activity important? You say, these type of activities, brainstorm activities, really help participants know that they are not alone and learn new strategies from one another. As you can see, the things that can cause fatigue really helps people to be able to understand that some things that they are doing, that they are in control, that are probably causing that fatigue, as well as what are some good ways for a good night's sleep. And those are some of the really great suggestions that somebody can feed off from each other, learning from one another. Anything else? Next slide, please. All right, so the last activity that we are going to be doing today will be the action planning. And like the brainstorming, action planning is a very big part of the Living Well series. So the Living Well chronic conditions, diabetes, and chronic pain. And action planning is something that that person or each individual wants to do, and not particularly what your loved one or your provider asks you to do. And if you do create an action goal, we do ask that it has to be achievable and action specific. And answer those questions that are on here. What specific action are you want to do? How much time of the day, days of the week, and how often in the day of the week, and your confidence level of completing that. And usually what happens is that we do create an action goal per week, and then we come back the following week to share with the group, and sharing if you were able to complete the action plan, and learning some barriers that might prevent you from achieving the action plan. I'm going to provide my action plan, just an example here. And if you all feel like providing any kind of action plan that's personal to you that you want to try this week, I think that would be awesome too. So my action plan this week, I told myself that I've been having some stress lately. And so my plan is to meditate and take more breathing exercises. So tonight, tomorrow, Thursday and Friday, I'm gonna meditate for at least 15 minutes each time. And my confidence level is gonna be a 9. Knowing that, that I can do that meditation before bed. And you can quickly, just provide that in the chat if you like, or if you want to share it. It's really up to you. Yeah. Okay. Awesome. Angela, I think you're muted.
Yeah, I'm muted into 2 places. I apologize. It's my headset. I can share my action plan. So year's end can be pretty busy for me, pretty hectic, filled with deadlines, and also year-end deadlines, as well as planning for the following year. And so one of my action plans to do is to create some more self-care downtime for myself. So I have gotten me a collection of books that I would like to start reading, at least take an hour a day out to do that once a day, or at least commit it to at least 5 to 6 days a week. Definitely so. My confidence level is about a 9 as well, because I really like reading, and the books that I got were some really interesting books, so I know that I will be reading them. And we have some others that have shared in the chat. Let's see what we have. We have from Rachel, we have, I will meditate one time for 10 minutes before next Wednesday. Confidence level is a 7. And we have Banyi, turn off the TV 5 to 7 times in a week. Confidence level is an 8. Jihan, let's see. Let's make this bigger. It's helpful. 20 minutes of treadmill twice a day for a week, morning and evening. Not sure about confidence level. I might be at capacity already. Well, the awareness and knowledge that, you could be at the capacity already. So it allows you to revisit those areas. Angelica, working out 4 times a week, 30 minutes. Confidence level is an 8. Hannah, I will do yoga the month of December 3 times per week for 30 minutes each. My confidence level is an 8. Wow, we got some good initiatives, good high numbers, confidence levels. And I'll turn it back over to you, Sue.
All right. Well, thank you all so much for providing your action plan and sharing that with us. The idea, the really important thing about action planning is to help participants be able to build that confidence. It doesn't even, we tell everyone that it doesn't matter if it has to do anything with mental health or physical health, but anything that's small could be like cleaning out a drawer or just doing something very simple. And that over time will help the participants make those small changes and be confident in creating action goals. And eventually, if it does, it can lead to making an action goal that for their health. And the last thing I want to share here is an impact story as well. And this is a story about George. George was reluctant to attend the Living Well with Diabetes class. He was told the class was there. He told the class that he was only there because his healthcare provider so strongly suggested it. He said he would not tolerate people telling him that he was doing everything wrong. George sat back quietly during the first few sessions, but by the third time, his barrier started to break down, and he engaged with other participants. After the last class, he waited in the hall to talk with the instructor. George said he never thought he could afford to eat properly, but now he knew that he could. For the first time, he felt that he was not alone and that he could control his diabetes. His diabetes did not control him. And shortly by the end of the class, George's healthcare provider called the instructor to thank her for the class. She noted a remarkable change in George's George's attitude, and that he was making better choices, that he was doing much better at managing his maintaining stable blood sugar levels.
And now I think we're going to hand it over to Juan to talk a little bit about his work at Sanford.
Hello, I'm Juan Perez. Like Angela said, I was hired at Sanford Worthington, Minnesota in August, and I'm the first community health worker here. Since I started, we have been working on finding good process and workflow to get patients referrals to me and get them enrolled in Juniper fall prevention classes. We had to start by introducing the role of a community health worker to our doctors. Many of them we already familiar with a community health worker since they had a worker with Novos County community health workers in the past. But there were new providers that we're just learning about the new role. Then we had to teach our doctor and providers about the Juniper and what the classes they are available and how to make a patient referral into electronically health record. This is an outgoing learning process and takes a lot of communication and reminders to them to stay on the top of their mind. Since I focus, maintain on the fall prevention classes, we start by talking to our orthopedic and physical therapist provider first about Juniper classes, since they could like to encounter the most of the risk patients. We thought this could be an easy access point to many patients who might qualify. I have also been learning about teaching Juniper classes, and I'm working on becoming the expert on the classes so I can speak with confidence about classes with the patients. Right now, a doctor or provider puts a referral in an electronic health record, and then it goes into a list that I see. Then I call this patient to talk about the class in classes that might be benefit for them the most. I manage all the Worthington referrals, and then I'm also assigned all the Spanish speaking patient referrals that comes from the whole Sanford network. This is not always many Spanish speaking classes available. So we also keep a waiting list for those referrals patient and call them back when one becomes available. While I talk to the patient, I attempt to complete a social determinant of health screening so I can learn what else is going on with the patient that we could help support together so we can address things going on in their life that are preventing them from putting their health as a priority. We can continue to inform the other Stanford Worthington doctors and provider group about classes. And at the same point, I might go out into the community and talk various groups about the classes and try to get enrolled that way. Anyone has any questions about my role?
Thank you so much for sharing, Juan.
Yes, thank you, Juan. CHWs are new to Juniper as part of our team. We've worked with them before as referrers, but we're excited to have 3 different CHWs that are part of our team now. And so next we'll give Angela the floor to talk a little bit about her work with Presbyterian Homes as part of the Juniper team.
Hello again, everyone. I'm one of the newest members to the Juniper team. I'm a CHW. I am a part of the new partnership with Juniper and the Presbyterian Homes. I meet with residents who need long-term assistance. I facilitate the fall prevention workshops. I conduct social determinants of health screening. I recognize needs beyond acute care needs. I assist with barriers to the social determinants of health by navigating community resources, for example, housing, transportation, and food, and beyond. I close the loops to referrals and recommendations, and I assist patients with system navigation.
Thank you, Angela.
You're welcome.
Very excited to have both Angela and Juan on our team. And last but not least, Sue and his work at Health Partners.
Well, hello, everyone again. My name is Sue Yang, and as Rachel and Angela mentioned, I am the 3rd community health worker. In addition to my community health worker work, I'm also a wellness engagement specialist with Juniper, and I started within Juniper in 2019, so I've been here for 2 years, and then as of August 2020, I enrolled in the community health worker program and graduated this past May of 2021. And with more about the community health worker and health partners work, so we applied for the pain management demonstration project through the Minnesota Department of Health in May of 2020 and received the award in June 2020. And this is a 2-year grant that we'll be able to demonstrate that will end on the June 30th of 2022. And by the end of our goal of this project, Juniper will demonstrate a pathway that integrates the healthcare and also social service system to provide a non-narcotic community-based pain management service that can be replicated across Minnesota. And there's two parts to our intervention here is to ensure that our classes will be accessible for patients who are living with chronic pain, a self-management program. And second is to integrate a community health worker in one of the Minnesota clinic, which is the Health Partners Neuroscience Center in St. Paul. And my role at the Health Partners Neuroscience Center is to receive warm referrals from providers after they see their patients and be able to close the loop and also be able to work with patients to register them into the self-management program. But in addition, also screen for social determinants of health needs that they might have, and providing resources and closing that loop when it comes to the referrals and touching base with the provider on the progress of the members, the patients. I started with the Neuroscience Center back in 2021, June of 2021, and have been with them thus far. And then we've been able to expand the CHW integration project to the Riverway clinic in Anoka as well. And I've been working with the pain clinic team and are hoping to also expand to primary care and other specialty groups to make myself more available, not just for the pain clinic, but providing a more holistic approach, because in addition to the Living Well Chronic Pain class, we have a variety of other Juniper classes that we can refer, we can talk with patients about. And so I want to leave with one impact story that I work with a patient. I received a referral from one of the providers to speak with a patient about the Living with Chronic Pain class. And this patient was a veteran and they live in a 55+ senior assisted living, has no family support or friends, lost her husband a few years back, but still grieving the loss, and every day experiences extreme pain, living with multiple chronic health conditions, suffers from chronic PTSD, insomnia, anxiety, and depression. And this patient has actually seen multiple providers in different countries before too, just to manage the chronic pain. And I was on the phone with this patient for at least an hour and being able to understand just what this person needs. And by the end of it, I was able to provide resources for the patient to see mental health providers within her area. And something that just kind of touched me too, and just make me think about the work that we all do coming back as a community health worker, is that we're bridging the gap between patients and the healthcare systems. And really hit me hard when she said, after listening to her, she said that, thank you so much for listening to me with empathy, no judgments. You're so compassionate, and I think you found the right calling. And I think where providers are being overwhelmed and overworked, this is where we fit in, being able to provide that gap, ensuring that patients that's beyond the acute care, and providing resources, education as needed.
Thank you, Sue, for sharing.
And we have a question for everyone now. Do you know anyone who would benefit from an evidence-based health promotion program, and why? And at this time, you can either share it in the chat box, or you can unmute yourself and share if you want.
I have a response in the chat box. My grandfather has fallen multiple times, and my dad, who has heart disease and is anxious about managing it. Another response, I think my parents would benefit from the fall prevention program because they have had falls. Although not in Minnesota, my dad that lives in rural Michigan, where they have lots of snow and ice, no one is around if he falls.
It looks like there was one more. My grandmother who has an imbalance from ear problem and is anxious about falling from dizziness. I don't think she would come in person, but a virtual one, definitely. Now, one more from Catherine. I have several patients I work with that I think would benefit not just for fall prevention, but from loneliness as well. And that's definitely been a theme during the pandemic. We see groups of people taking the same classes together and becoming friends and staying connected far beyond the class that they take. We were going to do a website demonstration for you, but unfortunately we run short on time. But our website, yourjuniper.org, is a great resource to go to find classes, make referrals. We have a referral platform there, and get more information about our classes. There is a tab here that says programs and classes that you can click on that has detailed information about all 13 programs that we offer. Are there any quick questions that someone has that we can answer before we wrap up? Concerns, emotional outbursts?
I was just thinking how I have been a community health worker for quite a while and have worked with older adults for many years, including now. And I was just wondering when Juniper started everything. I don't recall hearing about Juniper, but if I had known, I would have certainly had this as a resource in my CHW resource book.
Thank you. Yes, Juniper started in 2016 and we've had the website since 2018 and have been working to grow awareness since that time. And what you said about people not being aware of these evidence-based classes is one of the primary reasons Juniper exists. Evidence-based health promotion classes for older adults have been available in Minnesota for decades, but they've been difficult for people to find. And so having Juniper one central place where anyone in Minnesota can go to look is part of what we're trying to achieve.
Awesome, thank you.
Thank you for the question. Any others? One we get a lot is what is the cost for the classes? We do have contracts with Blue Cross Health Partners, UCare, and Itasca Medical Care MSHO members, so classes are free for those health plan members. Otherwise, classes are generally free or might ask for a donation. The community-based organizations that we work with receive grant funding to keep the costs low, but they might need to charge a small fee to cover the cost of the book or the room rental, etc. But costs are generally pretty low. We also get asked about the age to participate. These classes are geared to people 65 and older, but anyone over the age of 18 can attend. So sometimes we have multiple generations that are attending a class together, such as our diabetes prevention program, because they all have a similar health concern.